Welcome to the self-evaluation episode of the ASCO University weekly podcast. My name is Shadia Jalal, and I am a thoracic oncologist at Indiana University. Today, we feature a self-evaluation question on the treatment of EGFR mutation-positive non-small cell lung cancers, and we begin by reading the question. A 47-year-old never-smoking woman was diagnosed with stage 4 non-small cell lung cancer 15 months ago. Her initial imaging scans showed a primary lung mass in the right lower lobe, 3 metastatic liver lesions, and 1 right iliac bone lesion. MRI of the brain was normal. Ultrasound-guided biopsy of one of the liver lesions was performed. Pathology showed moderately differentiated adenocarcinoma, positive for cytokeratin 7 and TTF1, and negative for cytokeratin 20. Molecular profiling showed EGFR mutation with exon 19 deletion. The patient was started on a first-generation tyrosine kinase inhibitor known as erlotinib. A CAT scan after 3 months on erlotinib showed very good response with significant decrease in the size of the right lower lobe lung mass and all metastatic lesions. Treatment with erlotinib was continued with no signs of disease progression. Patient presented today for her routine oncology follow-up visit. She is tolerating erlotinib well. Her physical exam is unremarkable. However, a CAT scan showed a new lung lesion in the left lower lobe and an increase in the size of 2 of the liver lesions. Which of the following is the most appropriate next management step? Choices are A. Switch treatment to afatinib. B. Switch treatment to a platinum doublet chemotherapy regimen. C. Continue erlotinib and refer the patient for radiation therapy of the new lung cancer lesion. D. Obtain a positron emission tomography or PET scan. E. Refer the patient for a biopsy of the new lung lesion. The correct answer in this question is E. Refer the patient for a biopsy of the new lung lesion. The rationale is that this patient has metastatic EGFR mutation-positive lung adenocarcinoma that has progressed after first-line treatment with erlotinib, a tyrosine kinase inhibitor. The T790M mutation is an acquired point mutation in the EGFR gene, and it accounts for more than 50% of resistance to first-generation tyrosine kinase inhibitors. If the T790M mutation is detected, this patient should be offered treatment with osimertinib, which is a third-generation irreversible tyrosine kinase inhibitor that targets this particular mutation and has significant activity in this patient population. A repeat tumor tissue biopsy should be obtained in this patient in order to assess for the presence of the T790M mutation. Rationale for the wrong choices is as follows. A platinum doublet chemotherapy would be the appropriate treatment for this patient if she tested negative for the T790M mutation. There is no evidence that switching from erlotinib to afatinib would be associated with any benefit. In addition, since the patient has systemic progression of her disease, including in the liver, local radiation to her new lung lesion is not indicated. That could be a consideration if she had progression that was limited only to the new lung lesion. A PET scan in this circumstance does not provide any additional meaningful information that would change management, since the CAT scans she has had show clear progression in multiple areas. Of note, a recent phase 3 study known as the FLORA trial compared the efficacy and safety of osimertinib in patients with previously untreated EGFR mutation-positive advanced non-small cell lung cancer to first-generation tyrosine kinase inhibitors. Osimertinib was superior in progression-free survival and in response rate. In addition to that, it had a longer median duration of response as compared to erlotinib or gefitinib. a recent FDA approval for osimertinib first-line in untreated EGFR mutation positive patients has been granted. Therefore, osimertinib should be considered the first-line treatment option in these patients. Thank you for listening to this week's episode of the ASCO University Weekly Podcast.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.